Today, we are visiting the perennial challenge of defining Gulf War illness. Dr. Lea Steele wrote today's article, Prevalence and Patterns of Gulf War Illness in Kansas Veterans, when she directed the Persian Gulf War Veterans Health Initiative for the state of Kansas. Things have changed in the quarter century since Dr. Steele published the Kansas case definition of Gulf War illness. Let's reminisce with her about how she created it, what it has meant for research and care of veterans with Gulf War illness, and let's get her thoughts on what needs to happen to help Gulf War veterans today. Dr. Lea Steele is a neuro and environmental epidemiologist and professor at Baylor College of Medicine in Houston. She has conducted research on the health of Gulf War veterans since the late 1990s. Her current research, working with collaborators across the country, includes assessment, deployment exposures, and factors associated with veterans' long-term health problems. Welcome, Dr. Steele, and thanks for joining the Between Service and Science podcast today.
Thank you. Happy to be here.
So let's jump right into it. Dr. Steele, you have been pondering the question of what is Gulf War illness for many years, and you established one of the two definitions of Gulf War illness that is still used today for research. Tell us a little bit about how you established the Kansas case definition of Gulf War illness.
As you indicated, the state of Kansas established a program to look into the health problems that were reported by Gulf War veterans. They set this up in 1997, and it stemmed from some personal experiences from some of the government officials there whose family members had become sick after the Gulf War. So they knew of my work as an epidemiologist, and they asked me to come and oversee some aspects of the program, and specifically, they wanted us to address the questions of, do Gulf War veterans have health problems that are associated with their service in the Gulf War? And do those problems differ from what we'd see in other groups of veterans? And if so, what do the problems look like and how many people are affected? So that was the focus of the Gulf War study in Kansas in 1998.
And that sounds like a really important, understandable, and compelling question, right? I mean, it sounds like that just came out of the community's need for clarity.
Exactly.
Yeah.
To address this most effectively, we set up a systematic study to evaluate a large group of Gulf War veterans in Kansas and compare their health to veterans who were in the military during the Gulf War but did not serve in the Gulf War. So it is what's called a population-based epidemiologic study, and we developed a systematic survey instrument with the help from a lot of veterans, help from state officials, help from other researchers, and so it was a group effort, even though, I ended up writing the paper at the end. But
so Dr. Steele, you mentioned that you used a survey to get information about the veterans. Can you say a little bit more about how you used that information and how you analyzed it?
Yes, we had a questionnaire that we believed asked all the questions that would get at the heart of the problem. And so when we put all that information together and did a number of analytic processes that help us differentiate between deployed and non-deployed, we identified a pattern of symptoms that was mostly unique to Gulf War veterans, and it included 6 symptom domains. So the symptom domains include fatigue and sleep problems. That's the first one. The second one is pain symptoms. The third group is neurological, cognitive, and mood problems. The fourth group is GI symptoms. The fifth group is respiratory symptoms, and the sixth are skin symptoms. And all of these types of symptoms were much more prominent in Gulf War veterans than in non-deployed veterans. And then we had to determine which symptoms belong in the group. And this was also an analytic process. We included symptoms that were affiliated with the group more often than they occurred individually by themselves. And that gave us this very cohesive set of symptoms that consistently were found to be higher in Gulf War veterans.
Could you talk a little bit about some of the challenges that you encountered while doing the research to define Gulf War illness in the late 1990s? Maybe what do you wish you could have done differently?
That's
you go back in time.
Yes, actually, I really thought a lot about it. I can say that overall, there are some elements of the Kansas case definition that I think have held up very well. The symptom domains, for example, are still shown as differentiating, deployed from non-deployed veterans, they still affect Gulf War veterans at a higher rate, and actually even at a higher rate than they did in 1998. But the exclusionary conditions are really not functional at all for trying to identify who does and does not have Gulf War illness. Because at this point, veterans who had Gulf War illness from the get-go now have other conditions as well that you get with aging. And so you can't exclude them as not having Gulf War illness. And there are ways to address this, and we have limited ways that we currently use. But I think, as we'll discuss, I think we really need a reboot on this and to really put something together that more reflects current reality.
You did this research in the late 1990s, 1998.
Yeah, we started in 98 and completed in 99 and published in 2000.
So this was within 7 years of the actual deployment.
Yes.
And I know the case definition kind of focuses on symptoms that began during or after deployment.
Yes.
35 years later, today, we have veterans who are maybe going to report that, this symptom only began a year ago, 5 years ago, kind of long after the deployment. I guess this is another case of you were creating the definition at the time, you were doing this research at the time, and it's, the timing of the symptoms was maybe not as notable because they were all more proximate to the deployment. Do you have any thoughts about that?
I think you've really put your finger on what's going to be a key element when we improve and update the case definition. It will be important to determine and ask veterans when their symptom first became a persistent problem.
So where are we now with the case definition of Gulf War illness? As these veterans age and develop age-related conditions and symptoms, what should clinicians and researchers do to accurately identify veterans with Gulf War illness?
This is the important question for multiple purposes, both research and for clinical care of veterans. And I will say that veterans who have symptoms from the Gulf War, who then go on to develop more age-related symptoms, or veterans who didn't serve in the Gulf War, who develop age-related symptoms, trying to distinguish between those as time has gone on and as veterans age has really muddied the water. I think people who are really familiar with these conditions can accommodate in certain ways. We look for more severe symptoms, we look for timing of symptoms and things like that, but it's not systematically included in a case definition. So I think those are the types of things that we have large data sets now that we can evaluate how symptoms have changed with time. And all studies that I know of have shown that symptoms become more frequent, more prevalent, and more severe with time. But not only in veterans with Gulf War illness, in veterans who don't have Gulf War illness. Yeah. So as I said, it muddies the water and it makes the case definitions less precise in identifying who does and does not have Gulf War illness. But this can be addressed, and I think it's doable.
Do you want to say anything about the ICD-10 code related to Gulf War illness?
Sure.
The one that was approved in October of 2025?
Yes. That was quite a thing, and the veterans advocates that I know that helped put that together and have felt kind of marginalized in the healthcare system for many years have been very glad that happened. A lot of veterans are very glad, if they go to the doctor and the doctor tells them there's no such thing as Gulf War illness, they can say, they're looking for the diagnostic codes, the ICD-10.
Maybe we should just say that, there is not a diagnostic test.
No, and that's the whole
Gulf
problem.
War illness, right?
Yes.
I don't think we've actually said that yet.
I don't think so, but that's a key point. Thank you for.
And so, in the absence of a biomarker of Gulf War illness, we do rely on symptoms, and that hasn't changed after 35 years of research. Well, here's the closing question. Dr. Steele, what would you say are the most important things we can do to help veterans with Gulf War illness?
There's two things. One, I know there have long been clinical practice guidelines for DoD and VA providers that you have put together and have updated over the years. And you may know, but I don't know if those are being used by people, if federal practitioners are aware of them and take advantage of them, because that would at least provide some support to veterans. The other thing is that there are quite a few relatively recent studies that have identified treatments, mostly low-risk treatments, natural kinds of things that improve veteran symptoms.
Well, thank you very much, Dr. Steele, for taking the time to share your research with us and your very thoughtful comments about Gulf War illness.
Thank you. I appreciate you doing the podcast.
Yeah, great. We have just conversed with a living legend in the field of Gulf War illness. Dr. Steele has been a steadfast advocate for Gulf War veterans for more than 3 decades. And for Gulf War veterans still suffering with Gulf War illness, know that there are people like Dr. Steele helping you through research and new approaches to healthcare. This podcast is developed in collaboration with the Gulf Coast Center for Precision Environmental Health, and we appreciate their support. Thanks for listening. Let's keep searching for answers between service and science.